Paul with your weekly update for November 30th. The U.S. Preventive Task Force caused quite a stir recently when they revised their recommendations on the frequency and age for women to get mammograms. Many have speculated on the timing for this government-funded report, with the Senate vote on health care looming and cost estimates being watched closely. Just a hint that the government would risk women's health to cut costs is causing outrage on both sides of the aisle. Even the administration is alarmed at its own panel's recommendation. One official, the Secretary of Health and Human Services, Kathleen Sebelius, told women to ignore the new guidelines, keep doing what they are doing, and make the best decision for themselves after consulting with their doctors. This sounds like an excellent idea to me. As a physician myself, I understand the importance of ensuring that patients are able to consult their doctors and make their own decisions without interference from government bureaucrats or government-favored corporations. However, I am confused by the administration's reasoning and apparent change of heart. Have they reversed their position on health care reform and now decided that patients and doctors should be in control of individual health care decisions? Or are they still in the health care central planning business? The health care reform plans currently aims to empower Congress to dictate to insurers minimal standards of coverage. Those government standards will ultimately be determined by politicians and bureaucrats, not individual patients and doctors. It is naive to think that recommendations by an authoritative government panel will never be used to deny services to people that want them. It is sad to think that people will be forced to spend their hard-earned money for a one-size-fits-all government-mandated health care delivery model, but they have to scrape together additional funds to pay out of pocket for health care they really want or need. That is, if the government allows them to at all. After all, the federal government currently forbids Medicare beneficiaries from spending their own money on services covered by Medicare if, for whatever reason, they need to. Why wouldn't the government eventually apply these kinds of restrictions to everyone if they are successful with this takeover? Beware of the supposed gifts offered to you by government, for when it gives you things with one hand, the other hand takes away your liberty and independence. It remains to be seen what provisions will be in the final bill. We do know we have no funds to pay for it except for debt and money printed out of thin air. We know that the nation's creditors are getting very nervous about the government's continuous spending sprees and bailouts. We know this health care bill, like all government programs, will be expensive. There will be a day of reckoning when the credit stops and the bills for all the spending comes due. When that day comes and politicians and bureaucrats have to deal with reality, it will be very uncomfortable to find yourself in their liability column, which is where health care reform will put many more Americans. Thanks for calling this update. A new update is placed at this number, 888-322-1414, every Monday. The written text can be found on my website, www.house.gov/Paul, under the heading Texas Straight Talk. Thanks for calling.